My name is Peter Gwengi. I work for an organization called Victoria Initiatives, and we are a member of civil society organizations. So today we are having a meeting on domestic resource mobilization. You are aware that donor support is dwindling in all sectors. And as CSOs, our focus today was to mobilize resources to finance our health budget for Migori County. So we have come here as champions for domestic resource mobilization under the umbrella of CSOs network. So what we want to do, we want to have an engagement with the county government, and we are going to start with a meeting with the health committee at the assembly level so that we can sensitize them on what our intentions is going to be. And what we are focusing on, we are looking at expanding the coverage for NHIF to cover the people we are calling the indigent population. These are the people who are struggling with life, people who are unable even to put food on the table, but they also get sick. So we are saying that the county government needs to budget for them to see how they can be supported. And we're not just looking at the county government alone, we are also looking at the member of county assembly, we are also looking at the women rep, so that they can look into their own budgets, how they can support these populations that are struggling and are a part of their constituents. So that is what we are focusing on. We're also focusing on, there's an agreement at the AAU level that health budgets, there should be an increment of 10% budget allocation for health every year. So we are also going to push the county executive to make sure that this is achieved, looking at the health budget every year. Then we are also looking at the issues to do with social contracting. How can we work with the county government to implement activities in the community that are going to benefit the citizens of the county? So that was our focus for today's meeting here.
The 10% we are talking about is supposed to be an increment annually from the county budget. But even though it's an increment of 10%, increment annually, the three major diseases that she has talked about, that is malaria, TB, and HIV, should be given main focus, because this is where our main focus is. Many patients are really suffering from these diseases, but you find out that the donors outside are the ones supporting this, but the government has its own budget, has really not paid attention. So as domestic resource champions, we are advocating that even from ourselves, we can be able to resource our own resources that can cater for these diseases, even that the donors will be living away, going to other undeveloped countries, then still we ourselves in Kenya, we can go on and pursue ourselves even without the donor money.